Alright, so this is part 2 of the video. Again, we are going through our Module 4 discussion, question 1, and we're doing this together. So recently, we just talked about looking at allocation. And at the ending of the part 1 video, we were looking to determine whether or not the randomization method is unbiased. And again, to look at this information, you would look under randomization, and it'll essentially tell you something like this, like used an interactive voice response telephone service provided by whomever. This is again generally called the IBRS system. This is an automatic system that's set up to the study, and simply there are a few questions that are asked, like what is the patient's name? Oh, I'm sorry, not name, that's an identifier. What's the patient's date of birth, the patient's age, and we're all inclusion exclusion med, something along those lines. Maybe not necessarily those, but something along those lines. You would enter in the information, and then it would spit you out which group the patient has been assigned to. Okay, and this is what's considered as the method or the method for randomization. Another thing that you can look at is how closely groups may have been matched. For this, you can look within the results section, and I'll go over this more within the results presentation. But if you are wondering now, let's see, there should be a table in here somewhere. So this is table 1. So if you want to see how closely they were matched, you can look here. You see you have the interventional group and you have the control group. And this will tell you, you have the number of patients that were within each group. And then you can look at all of the characteristics and see how closely they were aligned. Okay? Another thing, so let me go back for a second. We didn't talk about inclusion and exclusion. Okay, just FYI, that information was found in table 1. And this is where you can see how closely they were matched. And this is all the information to show that. And if you want to know where to find inclusion exclusion, if you go back to the top of the paper, you'll see things like main outcome measures. What are we looking at? You will see an overall of the results. You will see intervention, the total number of participants. And these are all things, again, you would use to assess if you're just looking for quick information. For inclusion, exclusion, within this first section, it will kind of define what they used for inclusion and exclusion. And again, this would be used throughout the paper as well. So just FYI. So you can find that information in abstract. You can find some information in abstract, of course, because that's what it's there for. And then you would find the details of the information within the sections you're looking. So within the method section, since this is the section that we are appraising, this is where you would find all the details and the things that I've pointed out. Alright, so maintenance. The next thing we're going to look at is maintenance. What do I mean by maintenance? Well, maintenance is looking at, let's see, how do I phrase it? Basically, was the comparable status of the study groups maintained through equal treatment and adequate follow-up. So everything should stay the same for both groups, except maybe the introduction of the intervention. So you want to look at the maintenance through equal treatment and adequate follow-up. What were these? Where would you search this? You would find this in the trial design section of the method section. Again, we are looking throughout the method section. So here's the method section. If you go down to trial design and you read this section, you will find the information regarding maintenance. And for this, you're looking for things like, was like you would say something like the management was the same for both groups. The intervention was administered by the same podiatrist to all participants, something of that sort. So let's see, let's look at it within this section. So here we are in trial design. So here's a good example. 2 assessors were available for the assessments and were allocated to participants based on their availability. Each participant was tested by the same assessor at both the baseline and 6-month follow-up appointments. Okay? Both assessors were therapists. And then it goes into explain like the baseline assessment that was carried out, group allocation, randomization, those things. So it's just really going into looking within the method section for the answers you're looking for. And again, you can use that bias worksheet that you have been provided within Module 4 to help you look for this information. So another thing that we would look up is measurements and blinding. You basically want to know, were the outcomes measured with blinded subjects and assessors and or objective outcomes? Blinding, as we have talked about, is a great way to reduce bias. Okay, so where would you find this information within the method section? Well, you can find it in the trial design. And it'll say something to the effect that maybe the subjects were not blinded, but the assessors were. So let's see if I can find anything. Okay. So within this section, it didn't say that the patients were blinded, but it does say that the assessor was blinded. So you'll see assessor blind to group allocation. And there's a reason, because the consent required them to know. So within this case, only the assessors were blinded. Now, for further information regarding blinding, you can always look in the discussion section again, because it's a little more detailed with things. If you go to the discussion section of the paper, which is page 6, well, it starts on page 6 at the bottom, strengths and limitations of the study, you'll find a little more information about blinding within this section too. Okay? Alright. Last but not least, you want to look at measurements. Were the outcomes measured objectively? Okay? And with that being said, you basically want to state what are the objectives. This, again, you can find within the method section, and it will talk about the methods, or I'm sorry, the outcomes that are being studied. So let's go back up. So within the trial design, they'll talk about the different outcomes that you are looking at. Also, if you go back up to the abstract, it'll say what the main outcome measures are too. So you will see it somewhere like here. This is what we're looking at. Mean number of falls mean number of falls per participant, the number of experiencing 1 or more falls, and number experiencing 2 or more falls. So that's what we're looking at. So you'll find that in the abstract. Like I said, you'll find a lot of information there, but detailed information will be within the paper. That's why we're searching the method section, and the point is to appraise the method section, and you'll again find a little more information about the outcomes within the outcome section itself. Okay, so it'll talk about the outcomes there as well, but essentially you want to know, were the outcomes measured objectively. So let me just do a quick review of the things you will look at again. Okay, so first you'll look at recruitment. Were the subjects representative of the target population? Another thing you want to look at is allocation. Essentially, was the randomization method unbiased? Remember, we're checking to make sure that there is little as bias as possible within this article. We don't want the article to be biased. So you're searching to make sure that there are no bias. There is no bias. You are also going to look at maintenance. So was the comparable status of the study groups maintained through equal treatment? So you wanna again study the methods section and look and see if everything was pretty equal as far as how many patients were in each group and all the characteristics for each. Also, which I failed to mention, when you're studying maintenance, you also want to look at how many subjects were considered lost to follow up. So if, again, it'll state it within the method section, but there was a flow chart. Here's a flow chart. So within this flow chart, you'll see an overview of the number eligible, randomized, and within that, you'll see the number of individuals who did not complete. So who did not make it to the 12-month follow-up visit from each group, who did not make it to the 6-month follow-up visit within each group. This information is within this flowchart, so you can look here as well. Okay, so next you want to look at blinding measurements. What are the outcomes measured with blinded subjects and assessors, which we talked about. In this particular case, the patients weren't blinded, but the assessors were. And again, you find that within the trial design section of the methods section. And if you need more information, you can look at the strengths and limitations within the discussion section. And then last but not least, you want to look at objective outcomes. Were the outcomes measured objectively? And that you want to list and state what were the primary outcomes for this trial. I know this is a little all over the place, but it will make sense once you go through the article and look for these things yourself as well, okay? And if you guys need any more help, don't hesitate to ask. This is just a small overview of what we're looking for. I will do the exact same thing for the results sections, just FYI. That's a whole nother piece, but for this section of the module, for module 4, we're just going through methods. So these are the things that you are going to look at to complete your first part of your discussion questions. So you're using this article and you are essentially appraising this method section. And we talked about the things you're looking at. So again, a repeat, you're looking at recruitment, allocation, maintenance, and measurement, like blinding and objective measures. Okay? So use the bias tool that you've been provided within the module 4 to assist you with doing this. Make sure you highlight and scribble all over so you have an idea of where to find this information, and then go ahead and complete the discussion question. And if you have any other questions, you can give me a call or email me or text me, whichever works best for you. I hope this helps, and if you guys need any more visuals or any more lectures on it, let me know.